Hi, and welcome to this webinar in our series on mental health and performing artists. My name is Matthew Grierson, and I will be your host for today's conversation. These webinar recordings have been made available through a mental health working group arising from the International Association for Dance Medicine and Science. We hope today's webinar speaks not only to professional dancers, but also offers insights to those of you who care for dancers in clinical practice. Today, we've changed our format slightly. Rather than a pure presentational format, we are hoping for the speakers to engage in a little bit more of a back and forth dialogue. Of course, we hope today's conversation is very helpful, but we recognize a one-size-fits-all solution really isn't realistic. And for those of you who are struggling, please reach out to one of the local professionals in your community or call one of the crisis hotlines available. We will be posting some links also on our IADMS website. Joining me are 5 colleagues, experts in the field of dance medicine. By now, my panel should be very familiar to you, but for those of you new, let me introduce them. My name is Matthew Grierson. I'm a physiatrist and sports medicine physician practicing in Seattle, Washington. I am joined by Mr. Peter Lewton-Brain, an osteopath and the current president of IADMS, and he joins us from his home in Monte Carlo, Monaco. Dr. Nancy Kadel is an orthopedic surgeon and vice president of IADMS. She helps run the Seattle Clinic for Performing Artists with me. Dr. Linda Mainwaring is a psychologist, researcher, and associate professor at the University of Toronto. And Dr. Bonnie Robson, a retired psychiatrist who has had a long career of both research and advocacy in the world of dance medicine. And last but not least, Dr. Paula Thompson. She is a psychologist in practice in Los Angeles, California. She is a researcher, choreographer, and director of dance at California State University in Northridge. One of the things that I love about this group is how diverse it is and how we approach ideas like stress from so many different perspectives. Of course, for me as a musculoskeletal physician, I'm going to think about stress from more of a biomechanical analysis type of perspective. Someone comes in with an ankle sprain, I start worrying about the forces through the ankle, maybe issues at the hip or the spine. But of course, others on the panel are going to emphasize more of the mental health stresses. And that's really what we're here today to talk about, is the mental health side of things. And I'm noticing it, my colleagues, my patients right now, everybody is suffering. They might come in with low back pain, but under the surface is this anxiety, this stress of how am I going to get through this? And you can't turn on the TV or even the radio without being bombarded with images, with news stories. Stress is all around us. I was listening to NPR the other day, and one of the guests was talking about this idea of stress and coping and transformation, and how difficult situations like this can end up being very transformative experiences. And the quote he used was from 13th century poet and philosopher Rumi. Let me just read it for you. The wound is the place where the light enters you. The wound is the place where the light enters you. And so really the goals for today's webinar are to really start thinking more deeply about stress. We want to define it. We want to figure out what is the impact on the mind and the body. And we want to identify ways to cope with stressors. But I think we should just get into it. Paula, I think I'll start with you. How do you define stress?
Well, I'm going to answer it from clinical observation and also as a dance educator and a dance program director. But stress fundamentally is something that we're biologically able to manage. We need stress. It can be negative and it can be positive. And I know some of my colleagues are going to speak more directly about that. So I'm only going to speak about what I'm observing. And because I'm in Los Angeles, many dancers are freelance dancers. And the specific stressors that they are experiencing right now are twofold. One, incredible financial anxiety. And 2, food. They don't have the money to buy food. They have injuries, they have all of that other stuff, but they're just trying to figure out how to pay the bills and how to get food, which takes them to the other source of their anxiety.
And what they're saying is we've got too much stress, too much work overload, and not enough time. I can't handle everything. So they're saying, I don't know, they're afraid of what's coming next, the unpredictability. What do I do now?
And, I think we're all feeling stressed. I know for sure I'm feeling it. I feel, like Bonnie said, overwhelmed with more work, teaching classes, seeing clients, doing domestic work. But I'd just like to point out about stress and stressors. We call these events that trigger our stress response. They can be internal or external demands, pressures, or challenges. We call them stressors in the psychological jargon literature. And those stressors can trigger off all sorts of bodily reactions. And our autonomic nervous system has two components, a sympathetic nervous system and a parasympathetic nervous system. And the sympathetic nervous system, when we're faced with one of these triggers, either the mental stressor or the external stressor of not having any food or not having a gig or just feeling uncomfortable, our body reacts to that as though it might be a threat. And so there's a whole bunch of actions that take place in the body with hormones and neurochemicals, neurotransmitters that trigger what we call a fight or flight response, where our body takes action to fight that tiger or to run away from the tiger. And there are many ways that we may feel that physically. Our heart may pound, we may sweat, we may feel like there are butterflies in our stomach and feel nauseous, we may feel irritable, we may feel like our emotions are just being overwhelmed with all the work we have to do. But there is one thing that I wanted to point out, and it can be very difficult to do this in the face of not having food and not having gigs and your whole sense of worth being devalued. But there's been some very interesting research about how women, Shelley Taylor did this work about 2000, how women who connect to other people, it's not just a fight or flight response, it's what we call a tend and befriend reaction. So women have a tendency to connect with others, and that's a very important part of that. And the other thing I wanted to point out that's critically important is how we perceive stress. How we look at that trigger, how we look at that stressful event actually changes the way our body responds. And there's been fascinating research done in Madison, Wisconsin, and also in Rochester that actually shows if we respond to stress, looking at that issue as a challenge rather than a danger or a threat, our body will respond in a different way, and we won't feel quite as overwhelmed, and those chemicals are not as destructive to our body. They have clear correlations that if we think we have high stress, but we perceive it as not being as threatening, but it's a challenge, that we can actually harness that stressful response to do something positive. So it's our perceptions that are very important.
I find those perceptions are so relevant even within my field as a musculoskeletal doctor. A lot of my patients are in pain, and I can't always take away their pain, but I can impact their suffering. And a lot of it has to do with how you're framing it.
And they can actually feel kind of like passive. And at some point when that gets so passive, the system saturates and you flip over it. So you have this sort of point of just below a slow boiling pot. So you kind of think, oh, I'm calm. They said, yeah, I'm calm. And something happens, the reaction is just over the top, that they just flip into the extreme of the next system. That's just part of the autonomic nervous system, how it works, how it gets saturated and flips over. So they're having trouble dealing with these emotional swings and hormonal, as you said, and it switches, and it's just they just aren't used to that, because stress, you move, and there's no moving, but then you can flip into another phase, and that can be very frightening.
Peter, that's interesting. It almost gets into the concepts that Bonnie was mentioning in our last webinar about this optimum zone, you know, in terms of taking your emotional temperature, almost taking your stress temperature. It seems like you're right, there's a threshold between when too much is too much.
You know, one of the things that Linda Mainwaring mentioned just now, she talked about having to recognize, and recognition is so important, because once you know that you're there, once you know that you're at the edge of the boiling point, once you know that you're worried about what's coming next, then you can do something about it. As long as you're just free flowing and doing things and keeping yourself busy, you're not dealing with the issue. And dancers know this. They know they can deal with it once they recognize it. For example, when they're in performance, another dancer may come on at the wrong time or in the wrong place. And the dancers that I've talked to say, aha, That's the unexpected. I can handle that. I know what to do. I've thought about it. And so they go on, and we, the audience, have no idea that that happened. And the good news is that the things that help the dancer are body things, working with their body, doing body scans, progressive muscular relaxation, yoga breathing. These will help them calm down, move the energy from the part of the brain where they're all nervous and jittery, the amygdala, up to the prefrontal region where they're going to be able to make a good judgment. So what a body scan is taking it, basically a tour of the body as you're breathing, and it's usually done with your eyes closed, and you imagine taking your mind inside, that you're seeing your toes for the first time, and you breathe into your toes. That's right into your toes, and then gradually start to work up your body. So the back of your top of your foot, and gradually you breathe into your ankles and your shins and your calves. You get the idea. Dancers understand the part. But to make it a gradual process, so at the end, you've included your whole body. And maybe doing a body scan, it's often a yoga practice to start the yoga practice. And people have been doing it for 5,000 years. So we might join the group. It's got some value. And as you're breathing and you're bringing your whole body, trying to stay focused, practice makes it better. So some people will do a body scan for 2 minutes and be right in their space and calm, and then come back and ready to go on. Other people will work the 30 minutes to get the proper body scan, and both are right. Everybody's an individual. Now, I offer this tool. It's a psychological skill for you to try and use. Remember, it doesn't work for everyone. Not everyone reacts in the same way. So, but don't try it just once and then throw it away. Try it a couple of times and see if you can find that it will help you recognize what's really troubling you at this moment. And as you see that, then you go, aha, that I can work on that.
I think this is a nice segue into sort of the next part of our conversation, which is trying to give some of our viewers some concrete ideas of what they can be doing if they do feel stressed. Are there other thoughts that we might be able to give to our audience?
Well, I can give you a couple that I think are very useful. One, I talked about how we perceive stress. So if you appraise the situation, if you recognize it, like Bonnie said, and you appraise that situation as a challenge rather than a threat, and it's like, okay, how do I deal with this now? This is something that I'm going to have to figure out how to manage, and use it as a tool to get you where you might want to go. So cognitively appraise the situation is what we call it, appraisal. Reappraise it as perhaps a challenge. Another one is exercise to dissipate some of that information, that stress information in your body, get it out, cathartic. And another one, which is hard to do sometimes now, but laugh at ourselves, laugh at the situation, to release some of those chemicals in our body, those feel-good chemicals that are going to calm us down a little bit. So those are just 3 examples that I can think of that are going to help right now.
What I have observed in my clinical practice, we're actually looking at how to repair relationships, how to not personalize, how to listen, how to use I words instead of you, to try to learn relational skills, because we're all under pressure, and it's intensifying those relational behaviors. So that's one positive. The second positive is reaching out to others. I reached out to Peter. I have a wonderful young dancer who's passionate about having a career, and I asked Peter to have a look-see at his audition tape. Peter gave some amazingly wonderful comments. I shared them with this dancer. Quentin is his name. He's given me permission to use his name. And I thought, well, it's either going to discourage him or encourage him, because the feedback was very subtle and difficult to achieve. He immediately responded, I can slow down and work to really deeply understand and integrate how to move my fascia, how to move successionally, how to articulate with more nuance. So we're building a community that's far beyond our local borders.
I loved this group because I learn a lot every time we get together and speak. But I was thinking that, you know, as much as toward the end of my career, I didn't think I was going to have to learn all these new things, like how to do Zoom and how to have Zoom patient visits, there's been sort of the silver lining. So for instance, we were able to have this really interesting interaction with one of our dancer patients where both Matthew and I, so two physicians, were able to at the same time be meeting with the dancer, and we brought the physical therapist in, and we never get to have that interaction, all of us together. And so it was actually more efficient, and I think really beneficial, because in real time we could all ask our questions of the dancer, and the dancer could get their questions answered with all the perspective.
Those relationships, those explorations give us meaning. And without meaning, we don't have a sense of self. And Viktor Frankl said that perfectly when he was in the concentration camps. He realized that it's not about food, it's not about a lot of other things, it's about always having a sense of meaning. And those moments of meeting are meaning making. So they can be precious. We've just got to recognize them and value them.
Thank you. I think those are really great points. I've noticed, you know, finding the upside in things, the positive things that you can hold on to is very important. Peter, I know you had some great imagery about how one might think about the waltz as a way to use stress even to inform our dancing. I think the audience would really benefit from hearing about that. Can you share it with us?
Okay, so let's try using stress and our notion of musicality. So we're going to use the stress in a step, a waltz. So we're going to go down on the one, stress on the one, and the 2, 3, you're going to recuperation mode, parasympathetic mode, and you're going to recuperate. You're going to feel your skin change, your eyes dilate, your heartbeat go down, and it can be instant. So you're going to have 1, 2, 3, 1, 2, 3. And practice going between stress and release, action and recuperation. You can do it at home, and it'll be a great use when you get back to dancing. I mean, this is such an important thing for dancers. When I was young, I went to New York and I started dancing late, and I couldn't waltz. And Danila would come to me. She thought my name was John, so that made it worse, because she would, John, John. And then she'd slap me on my shoulder in the middle of the street and go, John, show me waltz. And I couldn't do it. So I didn't have the control of the autonomic nervous system to go action and release. So you're like, you know, what was the expression someone said? You look like cattle prodded. And Nureyev came and said, you know, no, all wrong. You should be like relaxed on top and tight on the bottom. And you're relaxed on the bottom and tight on top. But it's getting that, mastering that is just such a huge thing, and the waltz is perfect.
You know what? It's a lovely analogy, because you think about it. Stress, rest, rest, stress, rest, rest.
Yeah.
We need to do that. We need to,
And
sure, have the accent.
And you can do like
in
1, 2, 3,
beats.
4, 5, 6, 7, 8. No, stress, 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 release, 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 release. So getting that.
And next week when we talk about sleep, one of the tools I'm going to give is progressive muscular relaxation, which you all know, calendula wrap. But it's wonderful to help get with the initiation of sleep. It really does help. And it's the same thing. It's relax and then relax, having the opposite experience.
Thank you so much, Bonnie. I think that is a great exercise, and I look forward to learning more about that and other techniques at our next webinar on sleep and dreams. And with that, I think it is time to bring this current webinar to a close. And so I want to thank everyone on our expert panel today for sharing your time and your wisdom. And I learned a lot of great things today, and I hope you at home enjoyed your time, and thank you for joining us. We do have one ask. If you have found these webinars to be helpful, please leave a comment below in the comment section here if you're watching on YouTube. If you have any thoughts about how to make these webinars better, you can leave a comment there. We're also going to make a form available for people to fill out to give us feedback that way. We do want to make sure we're covering all of the relevant issues that you are facing right now. But thank you again for joining us. We look forward to seeing you for our next webinar. In the meantime, feel free to check out our website, iadms.org, for additional resources. Take care, stay safe, and be healthy.